EMT is filmed on location with the men and women of 195 Alpha. All scenes are considered unsafe until told otherwise. A 911 call comes in of a 58-year-old male complaining of chest pains and difficulty breathing after running.
Scene size up.
PSI, the scene safe.
Scene is safe.
My nature of illness seems to be difficulty breathing and chest pain. I notice I only have one patient. I will have additional EMS on standby, and I will consider C-spine, but not take it at this time.
Primary assessment.
Based upon my scene size up, I notice my patient is poor. Not money-wise, but his condition is poor. Sir, Airman First Class Kowalski from Metsi EMS. Can I help you?
See,
Sir, what is your name?
my name's Seymour. Last name Johnson.
Seymour Johnson. Sir, what is your location?
I'm on the track.
Correct. And what time is it?
It's 1 o'clock, I think.
Based on my patient's answers, I can tell that he is alert and responsive. Why did he call us today?
I can't breathe after running.
Our patient's chief complaint is difficulty breathing. I would then move on to my ABCs, starting with airway. Based on him being able to respond to me, his airway seems to be clear. Next, I would move on to breathing. At this point, typically, I would expose the chest, look for equal chest rise and fall, auscultate his lung sounds. But since this is a video for class, we will not be pulling off his shirt and exposing his chest. For that, we are sorry, Grantham. We know you would enjoy that. Next, I would have my partner put on a non-rebreather mask at 15 liters per minute.
No! No!
My patient doesn't seem to like that. He might be claustrophobic, at which point we would instead put a nasal cannula at 4 to 6 liters per minute.
Yes. Yes.
I would then move on to circulation. I would first check my patient's pulse.
Rapid.
Rapid. I would then move on to his skin color, condition, and temperature.
Pale. Clammy.
Based on those conditions, my patient might be going into shock, at which point I would treat with a blanket to keep him warm. Before that, though, I would have checked for any life-threatening bleeds, but my patient does not seem to have any. Based on my assessment at this point, and then possibly going into shock and difficulty breathing, I would put him as a high priority for transport.
What are you going to practice again?
Secondary assessment.
At this point, I would then move into history taking, starting with OP, QR, ST. First is O, Ante. Sir, what were you doing when this pain occurred?
I was running on the track.
P, provoke. Sir, does anything make this pain worse?
Breathing.
Breathing?
Breathing.
Q, quality. Can you describe the pain for me?
Like an elephant is hitting on my chest.
R, radiate. Sir, where is your pain? Can you point to it? Next is S for severity. Sir, on a scale of 1 to 10, 1 being not that bad at all, 10 being the worst pain in your life, what is your pain?
Well, compared to my last heart attack, it's about a 9.
Red flag!
Red flag!
You won't say that to the patient. T, time. When did this pain start, sir? How long ago?
Like 30 minutes ago?
That would complete the OPQRST. We would
Sample.
After the OPQRST, we'll move on to sample S, signs and symptoms, based on what we think it may be, in this case, cardiovascular and respiratory, so we do specific questions to those. Sir, have you had any coughs?
Yes. Not lately.
Did you seem to have any chills?
Yes. From time to time.
We'll now move on to A, allergies. Sir, do you have any allergies?
No.
M, medications. Sir, do you take any medications?
I take nitro
When was the last time you took the nitro?
before my run.
And is there any medications that you're not taking that you should be taking?
Nope.
And then move on to P, pertinent past history. Sir, have you ever had this pain before?
Well, yes, before I had my heart attack about 4 years ago,
Red flag!
and I had a stroke about a year ago.
Another red flag!
Only time.
We now move on to L, last oral intake. Sir, what was the last thing you ate or drank?
I don't remember.
E, events leading up to it. Sir, what happened before this pain? Anything that you could have felt that was going to cause this pain?
No, I was just breathing hard.
That would complete the sample as we get ready to move on to the focused physical.
Focused physical exam.
So based on the previous symptoms, we will focus our physical exam on his respiratory and cardiovascular. We'll start with his respiratory by assessing his chest for DCAP BTLS. Deformities, contusions, abrasions, penetrations and punctions, burns, tenderness, laceration, swelling. I would then again listen to his lung sounds. If he was not exposed previously, he'd be exposed now, but again for the video we can't do that, grant them. We continue to apologize. We would then move on to cardiovascular, which would also be DCAP BTLS. We will listen for his lung sounds again, check for jugular vein distension and ankle edema. That would complete the focus physical.
Vital signs.
After the focus physical, we then move on to vital signs. First, I would check patient's pulse.
105.
I would then move on to the blood pressure.
100.
I would check his respiratory rate.
23.
I would then check his skin condition, color, temperature.
Pale, cool, clammy.
And lastly, I would check the pupils for pearl, which is pupils equal, round, and reactive to light. Since you do not have any of this equipment, we were just going with it. Based on that would complete our baseline vitals, and we would move on to interventions.
Interventions.
After the vitals, we would then move on to interventions, at which point I would use my cell phone, not the ambulance radio or anything, to call medical control. During this call, I would request transport, since he is a high priority, and I would request an additional dose of nitroglycerin. I'm requesting an extra dose of nitroglycerin because my patient has it on him, and he took it less than 30 minutes ago, and he has a blood pressure of above 90. When I call, make sure when you call medical direction, you repeat everything they say to you, whether they give you permission or not, to make sure you both have equal communication and understand what each other is saying. When it comes to nitroglycerin, you want to make sure you have the 5 rights, the right patient, the right time between doses, the right route, the right patient, the right medication. We would then check the expiration date, make sure it's not expired. And then since he has taken it more than 5 minutes ago, and that he has it on him, and he has blood pressure above 90, we would then put a tablet underneath his tongue, make sure it is fully dissolved, after which point we would then reassess 2 minutes later to see if it has made him better, which we would do during the reassessment.
Reassessment.
After interventions is reassessment. Since we gave him the intervention, we would redo our reassessment 2 minutes later. If not, it would have been 5 minutes for unstable, 15 minutes for stable. During the reassessment, we will recheck his vitals. We will repeat the history to see if he's feeling better from the medicine. We will redo our physical exam and retake his vitals. Pretty much it. At which point, we should be in transport after getting the okay from medical control. Upon coming to the hospital, we would then give a full patient report so they know what they have to deal with. We would give the patient's age and sex, Mr. Seymour Johnson here, the chief complaint, the pertinent past history, the major past illnesses, the mental status, the baseline vitals with the additional vitals that we took during the reassessments, our physical exam findings, and the emergency care we gave, which was the nitroglycerin, and a patient's response, whether they were getting better or not. since earlier we were able to give him oxygen, we will tell them that we gave him oxygen through a nasal cannula 4 to 6 liters per minute, which was one of our interventions.
I feel good. We should play that song.
B.
Due to us not being able to edit this video, there were a few things that we messed up on. During the intervention call, I did not mention I gave our patient oxygen, and I did not verbalize his general complaint or my field impression of the patient. Our wonderful photographer or videotaper during this movie was Mrs. Madrid.
Good job.
Pause it. Pause it.
Shout out to HM2 Brown.
HM1 Nielsen.
And Staff Sergeant Eaton and the whole class 195.
Alpha.
Hope you enjoyed.